Anatomage patient case number 184, knee replacements and amputation. This patient has had both knees replaced and has lost the left foot. Using Anatomage 3D technology to look at the patient scan, we start by seeing the superficial muscles. Noticeable at first is atrophy, or shrinking of the left leg muscles. Atrophy is caused by vascular, neurological, or physical damages limiting the functionality of the muscles. Because the left foot is missing, there is clear evidence of physical disuse. By altering our view, tissues of lower density can be removed. We can see that the left lower limb has less higher density muscle than the right. Going even further lets us see the bones. Because contrast media was applied, we can also see the main arteries. Focusing on the left limb and zooming in, we can see evidence of an old fracture on the femur, since healed. We can also see osteophytes or bone spurs, likely a result of the injury. The left femoral artery is noticeably smaller than the right, again, a result of disuse. The artery itself has some calcification, likely originating at the time of trauma. Slicing from the top down, we can see the scattering of X-rays as we pass the metal of the knee replacements. It's unclear what the exact cause of the bilateral knee replacement was, but the most common cause is osteoarthritis, and in this particular case, it could have been post-traumatic arthritis. Cutting into our view to focus only on the left side, we can see the posterior and anterior tibial arteries running into the distal stump, and we can see dense bridging ossification at the distal ends of the tibia and fibula.